I've been involved in delivering healthcare services to the NHS for many years, and a few years ago we realised that the issue of doctors and other clinicians, their availability was getting a larger problem, and at the same time the demand from patients was getting greater. The demand from patients is going up because of the demographics, more and more people living longer. The analysis we show as well shows that actually obesity is putting a lot of demand, as we know, through things like diabetes and blood pressure. So basically we're in a situation where demand going up and no increase in the supply of the professionals to help us with the problem.
So unless we get a solution from things like DoctorLink, which you're going to tell us what it is in a few moments' time, we're going to see more stories like we saw already this week in the papers that were people are not going to their GPs, they're going to A&E instead, which is an absolute disaster and leads to a whole kind of loop of problems as well. So what is DoctorLink, and is it for the surgeries themselves or is it for the patients or a bit of both?
It's for both, but it needs to be embraced by the surgery, because what it is in simple terms, we are helping to get patients to put their symptoms in. They put their symptoms in, and once the system has assessed their symptoms, it's able to say, well, actually, you don't need an appointment with a doctor, or yes, you do need an appointment with a doctor, but very urgently. Or it can also look at the wider health economy and it can say, actually, there's a walk-in centre 5 miles away which could better deal with your sprained wrist. Why don't you go to the walk-in centre? So we're really trying to assess patient symptoms and then point them in the right direction with the right urgency.
I must say I've seen something like this at my local healthcare centre in the UK, and it's been fantastic. You couldn't actually get an appointment for days and days, possibly even for a week at the local doctor that you're registered with. You have to go to A&E, so it's alleviated some of those problems. But the question I have is really around the algorithm, because one of the problems with algorithms is that they do contain some element of bias because of who effectively creates the algorithm. So is there any bias in this particular one? Do you think it's going to correct over time?
We don't think so, because we do a lot of review of those algorithms. They're based on NICE guidelines, best medical evidence. It's not one doctor putting their view on how you should diagnose a situation. We use specialists in each of the different areas to do the algorithms, and then they're reviewed by a body of clinicians to say, is this safe and is this accurate? I mean, we are probably the only people who've gone through quite an intensive process, and therefore ours are indemnified. The insurers are saying these are safe, these are going to be okay for patients to use, and having run a healthcare business for a long time, the most important thing is safety. The one thing I don't want to preside over is an unsafe system.
Hey everybody, it's Hadley Gamble from our new CNBC Middle East Bureau in Abu Dhabi. Thanks for stopping by. Now to watch more, you can try one of the videos that just popped up on your screen. And don't forget to subscribe.